Hi everyone, I am Dr. Sagar Sahu and welcome to Vety Science. So today I welcome you to another MCQ lecture. Today we will be solving the 2022-23 Veterinary Assistant Surgeon exam of Odisha Public Service Commission. Okay, so before this I have already covered all other OPSCs, like 5 OPSCs. This is the last one before the coming one, that is on April 28th. Okay, so let us go to our MCQs. The first question is Osphrenic is present in case of camel. Okay, in case of cattle you will find Os cordis. In case of dog you will find Os penis. These are basically visceral bones. Okay, Os penis. Largest subarachnoid cistern is cisterna magna. Other name is cerebellomedullary system. Okay, next question. The source of oxygenated blood to fetus is by, it is umbilical vein. Just like pulmonary vein and artery, umbilical vein and artery, vein contains the oxygenated blood and the artery carries the deoxygenated blood. Next question, which of the following is the largest body cavity? It is abdomen. Next question, which of the following innervates the superior oblique? It is the trochlear. Eye has 4 oblique muscle, 2 oblique, 4 straight. The straights are innervated by number 3 and number 6 cranial nerve, while the obliques are innervated by number 6, number 4 and number 3. Number 3 is the oculomotor. Number 6 is the abducens. Number 4 is the trochlear. Okay, so which muscles innervate the number 3? The superior, the inferior and the medial, and the number 6 is by the lateral one. So in oblique the superior is number 4, while the inferior one is the number 3 cranial nerve. Okay, so the answer is trochlear. It is fourth cranial nerve is trochlear. Oculomotor is the third cranial nerve. Next, which of the following nerve should be blocked before dehorning? It is cornual. Very common question, cornual. Right carotid sheath include common carotid artery, jugular vein and the recurrent laryngeal nerve. It is a branch of vagus. It's a branch of vagus nerve. Vagus nerve is a part of carotid sheath. The answer is all of these. Extensions of forearm are innervated by the radial nerve, while the flexures are innervated by ulnar nerve. Number of sternal to asternal ribs in ox is 8:5. Answer is 8:5. 9:4 you will find in 10:8 in case of horse. 9:4 in case of dog. 7:6 is the case of rabbit. Okay. Next question. Largest head of tricep. Tricep have 3 heads, lateral, medial and long head. Answer is long head, which is the largest. Articulation between the roots of the teeth and alveolar socket. Very common question. Gomphosis. Okay. Syndesmosis is basically fibrous joint. Syndialysis, it is the joint between the vomer and the sphenoid. It is wedge and groove joint. Next question. Nasal cavity is divided into nasal meatus by turbinate bones. Nasal septum divides the nasal cavity into left and right.
left and right, while it is divided into meters by 12 minutes. Nervous tuning of the eye responsible for vision is retina. Retina. The choroid is the vascular tunic. Vascular tunic, while the sclera is the fibrous tunic. Fibrous tunic. Cornea is basically part of the sclera. Which of the following carries blood vessel and nerves? Answer is broad ligament. While all other ligaments which joins bone to bone are kind of avascular, they derive blood vessel from the peripheral circulation. While the broad ligament, you know that this carries the reproductive system. It has its own blood vessels and nerves. Number is 15. Cotyledon type placenta, you know, very common one, ruminants. Answer is cow. In case of horse and pig, you will find diffuse placenta, diffuse type of placenta. In case of dog, you will find zonary, zonary. And in case of primates, you will find the discoid. In case of primate, you will find discoid. Kidney is heart of playing card shape in case of horse. More exact one is the right kidney. Right kidney is heart. Next question. Which of the following is referred as urothelium? It is very common question. It is transitional epithelium. Transitional epithelium. We will find transitional epithelium in ureter, urinary bladder, and urethra. Okay. Podocytes are present in Bowman's capsule. They form the filtration slits. Filtration slit. Filtration slit. Which of the following is holocrine gland? Holocrine gland. You see, gland on the basis how they excrete the secretions are of three types. That is the merocrine, the apocrine, and holocrine. So the merocrine gland, in which there will be secretory granules which will be removed from the cell by the process of exocytosis. In case of apocrine, the apical part will be pinched off, which will act as secretions. The phenomenon is apical pinching. In case of holocrine, the entire cell will be secretory. The entire cell will be destroyed. Okay, entire cell will be acting as secretions. The examples of merocrine is the intestinal glands, sweat gland. Okay. For apocrine, the best example is mammary gland. For holocrine, here's the oil glands. The sebaceous and meibomian in eye. Meibomian gland, and it is present in eye. Basically oil gland. Okay. The answer is sebaceous gland. Next question. Cecum is paired in case of birds. Cecum is paired in case of birds. A parasite which requires more than one host to complete its life cycle is heterogeneous. Heterogeneous means more than one host. Okay. The best examples are cestodes. Most of these tests of nearly all cestodes are heterogeneous. Monogeneous parasite, it means it will have one host or the specific host. Okay, best example is Eimeria, Coccidia. Other options like urogenous has a broad host range. Host range is very broad. Best example is the Trypanosoma evansi. It has a very broad host range. Stenogenous parasite, it means very narrow host range. Narrow host range. Best example is the amphistomes like Gigantocotyle, gigantocotyle explanatum, gigantocotyle. Okay, gastrodiscus, they are very specific or very narrow posterior. Interploglottic glands present as a row of rosette. It is Monengia expansa. Monengia expansa. In case of Benedin, it is band-like. Band-like. From B, the band-like. Intestinal ceca is unbranched and simple. In case of fasciolopsis, in case of fasciola, it is branched. Branched. In case of fasciola hepatica, it is laterally branched. We will find lateral branching, while in case of gigantica or gigantica, whatever you pronounce it, it is lateral as well as medial branching. Okay. The amphistomes which occurs in bile duct of liver. Previous year also this question came, that is gigantocotyle explanatum. Another one, mostly amphistomes reside in rumen, except the gigantocotyle. Other one is the gastrodiscus. Gastrodiscus, which resides in large intestine. Large intestine. Okay. Next question. Number 25. Visceral larva migrans in children is caused by the Toxocara canis. Toxocara canis. The ankylostoma or hookworm causes cutaneous larva migrans. Avian schistosomiasis is caused by Trichobilharzia. Trichobilharzia. Strongyloides papulosus, it is commonly known as thread worms. Thread worms. Thread worms. The example of burrowing mite is Sarcoptes and Notodoros. A and C. The answer is both A and C. Next question. Malde coitus. It is basically Daurin. Malde coitus is the other name of Daurin. Daurin. It is caused by Trypanosoma equipartum. Trypanosoma ebansi causes Sora. Trypanosoma vivax causes African trypanosomiasis. African trypanosomiasis. Next question. Sulfonamide acts against the following endogenous stage. It is second generation Science. It is very good coccidiostat. Hepatodon canis infection in dog is mainly due to it is ingesting the infected tick. The most common tick or the responsible tick is Rhipicephalus sanguinis. Rhipicephalus sanguinis. Sanguinis. It is also known as the brown dog tick. Brown dog tick. Following are the species of Babesia in cattle except bovis is answer is Mortaceae. It is sheep. Ovis also. They both are of parasite of sheep. Okay. Next question. Cecal coccidiosis in poultry is caused by Eimeria tenella. Eimeria brunetti causes rectal coccidiosis. Eimeria vivati and Esophilina, they cause the intestinal coccidiosis. There is another one, Juerni, Eimeria juerni. It causes the winter coccidiosis. Toxavac T, it is a thelaria vaccine. Belongs to following type of vaccine: live attenuated vaccine. Worm nest in cattle is caused by Onchocerca. Answer is Onchocerca. Ceteria causes cerebral nematodosis. Staphylophila causes hump sore or ear sore. Hump sore. Paraphila causes summer bleeding. Okay. Next question. Number 34. Pilobolus fungi is involved in the dissemination larva of Dictyocylus viviparus, longworm of cattle. Dirophylla nematis is heartworm. Protostrongylus rufescens is basically red longworm sheep. Red longworm of sheep. Metastrongylus elongatus is found in pig. Pig. Host is pig. The principal modes of infection in Toxocara canis, prenatal yes, transmammary, truncal yes, all of this. Next question, the following are the morphological features of Haemonchus contractus. The answer is asymmetrical dorsal lobe, all other correct, except that you will also find Y-shaped dorsal ray. Y-shaped dorsal ray. Coppery red color skin is a characteristic feature of the Demodex, infestation of a Demodex species. The example of ornate tick is amblyomma and derma center. Sorry. Next question. The characteristic sign of gapes in poultry. Previous year also this question came, I think. Syngamous trachea. Okay. Prosthogonymous, it lies in bursa fabricis. Bursa of fabricis of bird. Bursa of fabricis. It's a lymphoid tissue. Ascaridia galli, you know that this is a roundworm of poultry. Roundworm of poultry. Tetrachis gallinarum is sickle foulworm. Sickle foulworm. Next question, Hyaloma species is a type of, you see, if you will go to books or some internet, it is having one host tick, two host tick, all of them, but it is mostly three host tick. Father of cellular pathology is Rudolf Virchow. Robert Koch is father of microbiology. Paracelsus toxicology. Hippocrates modern medicine. Okay, father of medicine also. Vesicle or blister is a good example of hydropic degeneration. Peppered lung, it means black coloration of lung, is a feature of anthracosis. These are very straightforward questions, not much of conceptual question. This entire paper was very much, you say, ratta type or moggu type. In India, we say like those who only study, remember things. Okay, this entire paper having very less conceptual questions. I got really bored while solving this one. Chronic hepatitis is otherwise called as cirrhosis. Cirrhosis is also called as chronic hepatitis. Uremia, increase in urea concentration in blood. Azoturia, increase in nitrogenous waste in urine. Sawdust liver is the other name of the hepatic necrosis. Nutritional hepatic necrosis. I was forgetting the name. Nutritional hepatic necrosis. It happens due to vitamin E or selenium deficiency. Spread of tumor cells in the body cavity is transcelomic spread. You know, lymphatic spread and also bloodstream. Permeation means when you will find colony of cancer cells along the lymphatic vessels. It is permeation along the lymphatic vessels. Abnormal accumulation of cerebrospinal fluid in an hydrocephalus. Hydrocele is basically accumulation of fluid in the scrotum. Hydroperitoneum in the abdomen, fluid accumulation in the abdomen. Hydrometra, fluid accumulation in the uterus. Next question, increase in number of cells is called hyperplasia. Dysplasia means the normal cell will be replaced by abnormal cells. Hypertrophy, it means when the individual cell size is increase. Atrophied when the individual cell size is decreased. Cell nests is a feature of squamous cell carcinoma, SCC, squamous cell carcinoma. The routine fixative used for tissue biopsy is 10% neutral buffered formalin. Xylene is basically a clearing agent which makes tissue more transparent. 40% neutral buffers of formalin. It is a stock solution. Okay, stock solution from which the 10% is made. DPX is mounting, used for mounting. Keyson's disease is due to air embolism. Saddle thrombus is the consequences of aortic thromboembolism. Next question. A viral disease of chicken characterized by hemorrhages in thigh and breast muscle, IBD, infectious bursal disease. In case of Ranikhet disease, you will find pinpoint hemorrhages in proventricular gland. It is very much characteristic. Proventricular gland. In case of foul cholera, you will find hemorrhages in fats. Hemorrhages mostly abdominal fat, pericardial. Also, you will find pericardial fat in gizzard. Infectious bronchitis, you will find mucoid plug of pus in primary and secondary bronchus or bronchi. Plural is bronchi. Nutritional group in chicken occurs due to deficiency of vitamin A. Pedunculated and distorted ova with a long. This is a very characteristic question. You know, like copy and pasted question. It's Pullorum disease. Next question, 54. Histological features seen in broader pneumonia, granulomatous pneumonia. Bronze discoloration of liver. This question also came in last year. It is foul typhoid. Answer is foul typhoid. Intranuclear inclusion body in the hepatocyte is a feature of ICH, infectious canine hepatitis. In case of canine distemper, you will find intracytoplasmic inclusion body in the glial cells, brain. Parvoviral enteritis, you will find intranuclear inclusion body in the intestinal cells. Vegetative endocarditis is a feature of swine erysipelas in case of pigs. Okay, African swine fever, you will find subepidermal hemorrhages. FMD, you know, many characters like a foot and a lesion, foot and mouth, as well as you will find tigroid heart. Classical swine fever, it has very distinct pathognomonic lesions, like you will find turkey egg appearance of kidney. You will find button shape ulcer in case of large intestine, and also you will find there is another one lesion which I am forgetting. You will find some hemorrhagic spots also. I am forgetting. If you know there is another one, do comment down below. Okay, there is another one in classical swine fever or hog cholera. The other name is hog cholera. Marbling of lung is a feature of CBPP, contagious bovine pneumonia. Button ulcers in Abomajab. This question also came in previous year question 2021-22. Answer is theileriosis. Okay, theileriosis. Alveolar epithelial metaplasia is a feature of Jacques-Ciecte. It is also known as ovine pulmonary adenomatosis, pulmonary adenomatosis, adenomatosis. Here the pulmonary, okay, so it is alveolar. Rhinopes, thalers, and erysipelas primarily do not affect the lung. Among sometimes you have to exclude other option to find the correct option. Among the following aerobic method of producing compost is, you see aerobic method, there is also anaerobic method. Anaerobic examples of aerobic is mechanical method and indoor method. The anaerobic is Bangalore and Coimbatore. These are basically management of organic. Coimbatore. Okay, organic waste management. Okay, the Bangalore method is also known as the hot fermentation. Answer is mechanical composting. Okay, Bangalore method, other name is hot fermentation. Ramp composting is basically for solid waste management. Blood splashing occurs during stunning. The exact answer will be improper stunning. Stunning is basically a procedure just before the killing. You have to make the animal unconscious. That is stunning. Okay, this is a good abattoir practices under which it comes. So during the improper stunning, if you are doing some stunning but the animal is not unconscious, it will increase the blood pressure, which will further, the smaller vessel will rupture in the muscle, causing the blood splash. Okay. Next, alkaligenous group of organisms are mainly responsible for the condition of ropiness. Alkaligenous causes ropiness. Lipolysis and the musty flavor, they are mostly caused by Pseudomonas and the bitty cream. Pseudomonas. The bitty cream is caused by Bacillus. A neutralizer added to milk is sodium bicarbonate. It is used for short-term storage. For long-term storage, formalin is added, which is very, very hazardous. Okay. Formalin is for long-term storage. Starch is added to increase the solid percentage. Next question. Post-pasteurization contamination will be least in in-bottle pasteurization. Why? In case of VAT, vacuum and coil pasteurization, the milk will be pasteurized in large containers, then it will be packaged. So during this package there will be post-pasteurization contamination. But in case of in-bottle pasteurization, the milk will be packaged into special made bottles, and then it will be pasteurized. So post-pasteurization contamination is minimum in in-bottle pasteurization. The risk of infection by this pathogen from refrigerated food, Listeria, it can survive cold temperatures. The occupation related to rickettsial disease in abattoir workers. Rickettsial, Q fever, Coxiella burnetii, Coxiella species. Erysipeloid is caused by erysipelothrips. Erysipelothrips or whatever. It is very difficult to spell these things. Or is contagious ecthyma. Lyme disease caused by Borrelia. Next question. 68. Among the following, the here the reading question is sometimes important. Nematode, because we are so trained, when we will see that the following which is transmitted from feces to human being, immediately we can answer the Diphyllobathrium lactum, which is a tapeworm. Okay, the answer is the question is nematode. It is Anisakis simplex. Okay, these two are tapeworms or cestodes. Okay, this is a trematode. Hemasthala is a trematode. All are fish worms. Okay, but Anisakis simplex is the answer, which is a nematode. The use of following method of water purification is zero hardware reverse osmosis. So this is reverse osmosis. Hot water supplied to inside the abator should have temperature of 82 degrees Celsius. 82 degrees Celsius. The process which refers to the uptake of dissolved plus ingested phase of a toxicant from water. Water is bioconcentration. If the question has been changed from water to environment, it is bioaccumulation. Biomagnification means when you will go up the food chain, the concentration of toxic thing, which toxicant, will get increased. That is biomagnification. Biotransformation means when a toxicant enters the body, what body does to that particular chemical or toxin, that is biotransformation. The definitive host for Echinococcus granulosus is dog. Answer is dog. Among the following, which produces more waste for each kilogram of the actual produce, and answer is tannery. It produces nearly 0.5 to 0.6 kg of waste or 1 kg of leather. Okay, high waste one. Ability of a diagnostic test to detect true positive is sensitivity. If it is changed, the question is true negative is specificity. Okay, answer is sensitivity, but if the question will be changed, it is specificity. A proposition that can be tested formally, after which it may be supported or rejected, it is hypothesis. Hypothesis. Theory is basically well supported explanation. In man, leptospira mainly causes jaundice. Icterus. Taenia saginata and Taenia solium fall under the category of cyclozoonosis. Answer is cyclozoonosis, in which 2 vertebrate host is needed. Metazoonosis, you will find 1 vertebrate host plus 1 invertebrate host. Best example is plague. Diatozoonosis, by contact or food or water it can be transmitted, like example is brucellosis. Zooanthroposis, from human to animal. Best example is TB, tuberculosis. Animal involved in the transmission of Haverhill fever. The other name of Haverhill fever is rat bite fever. Sometimes knowing the other name can help you. Rat bite means the transmission is by rat. A zoonotic disease which is caused by prions. Zoonotic means from animal to human. Bovine spongiform encephalopathy, which is caused by the prion. Ebola is by virus. Kuru and GSS, they are also caused by prions, but they are primarily a disease of human. Next question. Fungal diseases are mainly transmitted by fomites, inanimate objects. Fomites, like the dress or the bed sheets, chadars, all those things. The golden period of wound is 6 to 8 hours. Surgery questions. 6 to 8 hours. This is a golden period. Ideally, it is 6 hours. Catgut is prepared from, this is in our answer key. The answer is actually wrong. In both serosal layer of cattle small intestine and as well as submersive intestine, it can be produced. Answer is given B, but the actual answer is C. Both A and B. Opening of a ripened abscess is known as lancing. Technical term is lancing. Excision means something to excise out, like tumor excision. Counter opening means, suppose there is something, it may be cyst, it may be abscess or something. Opening is some anti-gravity site, so you have to make a counter opening so that it can be drained easily. That is counter opening. It can be applied to abscess also. Rule of aseptic technique must be followed to prevent contamination, wound contamination. Abnormal cavity containing pus is known as abscess. If it is a body cavity, then it is empyema. Phlegmon, this is spelling mistake. In this particular question paper, there are very much spelling mistakes. Okay, so it is phlegmon or cellulitis. Okay, it is one word, phlegmon or cellulitis, nothing like that. So it is basically soft tissue inflammation. You have seen very good case of you might have seen very good case of cellulitis in case of cats. The small wound, bite wound, then there will be entire cellulitis of entire limb. Antibioma is basically a tough wall abscess. It happens due to improper or inadequate drainage of abscess and also using broad spectrum antibiotics for a long time. When you will try to cure an abscess through only giving antibiotics, the fluid portion will get absorbed and it will have very thick pus, that's antibioma. Polydiagonal suture is synthetic monofilament, yes. Polymer or paradiagon, that is why polydiagon. Absorbed in 180 days, answer is all of this. Next question, collagen suture is prepared from flexor tendon, bovine steer flexor tendon. The disadvantage of silk are there will be tissue reaction compared to polyamide. Capillary action, yes, all the multifilament sutures have some capillary action. Cutting through tissue compared to monofilament, they are more cutting because of braided appearance. Okay, the answer is all of these. The site of epidural anesthesia in dog is at the lumbosacral. Most common is lumbosacral. Lumbosacral between the periosteum means simply vertebral canal and dura mater, that is epidural space. Okay, between the dura and arachnoid, subdura, arachnoid and pia, subarachnoid space. Surgical opening of the crop in bird, ingluviotomy. Okay, caponation is the basically the male bird sterilization. This is pinioning. Okay, pinioning, spelling mistake is there. Pinioning means removing the farthest joint of a feather. Removing the pinion joint. It is the farthest joint of the wing where the flight feathers are attached. Okay, pinion joint. I have no idea regarding uvalotomy. If you have some idea, I did not found anything like uvalotomy. Might be some spelling mistake, I don't know. The Peterson block desensitize all the nerves supplying to the muscles. That is 3rd, 4th and 6th. Answer is 3rd, 4th and 6th. And also it desensitize some ophthalmic branches of 5th cranial. That is trigeminal. Ophthalmic branches of 5th cranial nerve. IVDD actually is intervertebral disc disease. It's most common in German Shepherd. The principle of ultrasound is scanning, refraction, diffraction, pulse echo principle. 94. Fasting in equine helps in, answer is all of this. It prevents gastric rupture. It also increases the extension of lung. Okay, and also prevents the food material entering the trachea because the relaxation of esophageal sphincter. The reversal agent of narcotics, you see very commonly you will find two reversal agent, naloxone and another is naltrexone, while all of them are basically the antagonist. Okay, reversal agents like diprenorphine, it is used to reverse the effect of one of the most potent opioids, that is etorphine hydrochloride. Okay, so all of them are basically the antagonist or you can say reversal agent, but most commonly naloxone and naltrexone you will find. Next question, factors affecting radiographic quality, kilovoltage potential and milliampere, both them. Fredette-Ramstedt pyloromyotomy, incision into the pyloric muscles. The answer is pyloric stenosis. GDP, you know, the gastric dilatation and volvulus. Gastric also you know. Zollinger-Ellison syndrome, it means you will find gastrinomas of pancreas and upper intestine. Upper intestine, due to which there will be increase in gastrin hormone, gastrin production. This is known as Zollinger-Ellison syndrome. Next question, growth of conjunctiva extending towards cornea is pterygium. Answer is pterygium. Symblepharon, joining of the bulbar and the palpebral conjunctiva. Conjunctivitis, inflammation of conjunctiva. Dermoid is basically misplaced embryonic tissue, mostly commonly skin. Okay, most commonly skin. 99. Traumatic reticuloperitonitis is engorged jugular vein. You will find jugular vein, edema of duvula punctures. Answer is all of this. Bull's eye appearance of intestine in ultrasound is very much characteristic to intussusception. It is to intussusception. Coming to the question number 101, sebaceous cyst that forms in the caudal portion of the false nostrils. Answer is atheroma. It is a disease of horse. Okay, polyps is basically overgrowth or proliferation of the mucosal membrane. Lupus is the inflammation of the hard palate. Inflammation of the hard palate. What is basically benign skin growth? Benign skin growth. Okay. Surgical site for approaching heart by thoracotomy is 4th to 5th intercostal space. Next question, scrotal hernia termed as osteocele. It is termed as osteocele. Bubonocele is basically inguinal hernia. Inguinal hernia. Exomphalus and omphalocele basically represents umbilical hernia or pathology associated with umbilical hernia. Glans penis cannot be excluded from the prepuce. The condition is phimosis and the reverse condition is paraphimosis. Posthitis is basically inflammation of the foreskin of glans penis. Priapism known as the persistent erection. Persistent erection of penis. Contusion of sensitive laminae at the wall and bars, it is known as corn. Thrush is basically degeneration of frog. Degeneration of frog, most particularly or commonly by anaerobic organisms. Anaerobic organisms. Quitter is a chronic inflammation of the collateral cartilage. Collateral cartilage. Spavin is basically inflammation of the hog joint, most probably the synovial membrane. Hog joint, there will be fluid accumulation resulting in swelling. Spavin. These terminology associated with equine lameness. Okay, equine lameness. Next question, 106. Rebecca-Lansfeld classification is used for the group identification of Streptococcus. Salmonella gallidranum causes the condition fowl typhoid. Fowl cholera is caused by the Pasteurella multocida. Fowl CRD, that is chronic respiratory disease, it is caused by the Mycoplasma gallinarum. Okay. Fowl cholera is caused by Haemophilus paragallinarum. Special media used for the isolation of Bacillus anthracis is plate, PLET, plate media. Okay, mannitol salt agar is used for Staphylococcus. In Asian countries, bovine pasteurellosis is caused by B2. Okay, B is the serogrouping and 2 is the serotyping. There is 5 groups A, B, D, E, F, and their serotype is from 1 to 16. Different combination can happen. Cold enrichment is required for the isolation of Listeria. These are very direct questions. Okay, like Rotta questions. Warthog serves as natural reservoir of ASF, African swine fever. Calf snatching phenomenon is a feature of influenza, orthomyxovirus. Influenza virus, most common example. The elementary bodies in the inclusion body of fowlpox infected are called Borel bodies. Borel bodies. Okay, Guernin bodies you will find in pox virus. Pox. Reticulate bodies is associated with chlamydia. Negri bodies, you know this one, very common, rabies. Predilection site of infectious bursal disease is bursa parvovirus. The biological vector transmitting blue tongue virus is Culicoides. Tabanus trypanosoma evansi transmits. Sesefly, African trypanosomiasis. Stomoxis habronema transmits habronema. Also Setaria. Okay. Smallpox vaccine was developed by Edward Jenner. Louis Pasteur, pasteurization discovered or invented, whatever. Pasteurization. Robert Koch, tubercle bacillus. Discovered tubercle bacillus. Joseph Lister, antiseptic surgery. Okay. Next question. Transfer of bacteria DNA by bacteriophage is transduction. Transduction. When it will be taken from the environment, it is transformation. When direct contact, conjugation. Translation is basically protein synthesis. The yolk sac route of virus infection inoculation should be done at the 6 to 8. In some viruses and some articles also it is 10 to 12. The replication of one virus in cell inhibited by replication of second virus, it is viral interference. Okay, hem adsorption means to the virus RBC will get attached or adsorbed, that is hem adsorption. Okay, CP is cytopathic effect. When live cell culture is used, the virus produces some effect, that is cytopathic effect. Hemagglutination is coupling of RBC. Answer is viral interference. The reverse transcriptase is the enzyme present in, you know that most commonly it is retrovirus, but HepaDNA virus, that is hepatitis B virus, is also having reverse transcriptase. Answer is both A and B. The immunity is acquired following vaccination is artificial active immunity. Okay, because you are giving some antigen against which antibody will be produced. Example of artificial passive immunity, when you inject directly the antibodies. Natural active immunity is by infection. When something is infected, then you get immunity. Natural passive is through colostrum, contains maternal antibodies. Okay, that is natural passive immunity. Maternal antibodies. Next question. Cytotoxic T cells are CD8. They contain CD8. The T helper contains CD4. For agglutination test, the antigen should be particulate, but for precipitation test, antigen should be soluble. Next question. J chain is present in IgA as well as IgM. Immunologic unresponsiveness against individual's own antigen is referred as immunotolerance. Autoimmunity means when the immune system attacks the own cells, its own cells. Immune potential, increased immune response. Immunodeficiency, decreased immune response. Next question. Superficial mycosis is caused by, this is most commonly by dermatophytes. They are basically known as ringworms, but all of them can produce some skin lesions, or they are more particular about superficial mycosis. Anosporidium can cause the nodules on the mucous membrane. Candida, both skin and mucous membrane. Aspergillus is mostly responsible for the infection in the respiratory system. Cigar-shaped bodies are characteristics of Sporothrix seneca. Characteristics, terry towel appearance. I didn't found this particular thing in internet also. I also saw book. I did not found this one. If you have any relative answer to this one, do comment down below. Give the link also. The answer is actually Candida albicans according to the answer key, but I don't know this particular question's answer. Okay, answer is Candida albicans, terry towel appearance. The common mounting solution for demonstration of mold is lactophenol cotton blue. Methylene blue is used for staining of the cells. Okay. Carbamazepine is a acid fast stain. Crystal violet is a part of gram stain. Estrogenic mycotoxin causing reproductive disorder in swine. This question came in previous year also. GLNO. It is secreted or produced by one of the Fusarium species fungus. Okay, it causes vulvovaginitis. Ojena refers to the foul smelling odor of nasal cavity. That too of oral cavity is known as halitosis. The principal toxin of E. coli belong to which of the principal toxin is LPS, that is lipopolysaccharide, is basically endotoxin. This E. coli also produced a cigatoxin, which is a exotoxin. Okay, cigatoxin, which is exotoxin. Which one of the following is the most common cause of dehydration in animals? Among all four options, diarrhea is the most common one. Okay, compared to other options like vomiting, polyuria, and excess salivation. The most effective alkalinizer used for us means orally in the treatment of acid indigestion is magnesium hydroxide. Dose rate is around 500 gram for 450 kg body weight. Okay, in an adult cow, you can give 500 gram of magnesium hydroxide. Next question. Vinegar 5% is used in the treatment of urea poisoning. This is used in case of urea poisoning. Here you need nearly 2 to 6 liters of vinegar, ruminal infusion in an adult cow. Ruminal infusion. Which of the lemurs is more likely to ingest foreign bodies? It is cattle, because they have a indiscriminate feeding behavior. And also the lips of cattle, they do not act as prehensile organ. Instead, tongue acts as the prehensile organ in case of cattle. Sheep and goat are basically browsers. Okay, browsers. Selective feeding. The term melena describes which of the following? Fishes containing digestive blood is known as melena, while fishes containing raw blood is hematochezia. Fishes containing raw blood is hematochezia. Which one of the following is mostly recommended for the treatment of prolonged anorexia? It is cord transfer, rumen cord transfer. Pit scour is associated with the deficiency of copper. Also, it is associated with molybdenum toxicity. When molybdenum concentration will go high, copper will get low, or there will be deficiency of copper. The major precursor of glucose in ruminants is propionic acid. You know this one, propionic acid. These are very direct questions. The best antioxidant that prevents damage to sensitive membrane lipids is E, alpha tocopherol. Vitamin E, which is known as alpha tocopherol. Okay, alpha tocopherol. Next question. Ovine ketosis occurs mostly during last 2 weeks of pregnancy. A circumscribed solid elevation of skin involving a diameter of more than 0.5 cm is actually, the answer is nodule. It is nodule, but there isn't any option. If it is been less than 0.5 cm, then option answer is papule. In your key it is written papule, but papule is actually less than 0.5 cm. Okay, more than 0.5 cm is nodule. Macule and patch, they are basically skin discoloration. You papule and nodule, you can feel a solid elevation, while macule and patch, this is just skin discoloration. You cannot feel this one. Okay. When it is less than 1 cm, it is macule. When it is more than 1 cm, it is a patch. Pustule is basically a vesicle containing pus, or the fluid which should be watery, it is now pus filled. That is pustule. Kangaroo sitting posture in suggestive of dash in deficiency in pigs. Biotin. Deficiency of pantothenic acid, goose stepping. Steely wool occurs in sheep due to deficiency of copper. Here actually natural cream or the waviness is lost. Okay, natural waviness, or scientifically it is known as cream, is lost due to copper deficiency. Husk or hooch in cattle is caused by longworm, that is Dictocalus viviparus. Dictocalus viviparus, sheep, it causes in case of sheep. This is a worm of horse. Mullaris capillaris, this is known as hair longworm, I think. I am slightly forgetting. Hair longworm of sheep. Okay. Next question, 147. Which of the following best describes the pattern of infectious bovine rhinotracheosis? High morbidity, low mortality. Same as another example you can take FMD. FMD is also high morbidity, low mortality. Which of the following is not the list of differential diagnosis when considering a cow that may have rabies? Most prompt clinical sign in field, you will find that it will having salivation and frothiness, froth around mouth. Okay, so in esophageal foreign body you will find high salivation, so there is a differential diagnosis. Hypomagnesemia due to tetany, you will find a frothiness in the mouth, so This is also a differentiating disease, but not the brucellosis. The answer is brucellosis. Hysteresis, that is nervous breakdown. When there will be nervous signs due to convulsions, you will find froth on the mouth. So all these three can be esophageal foreign body, hypomagnesemia, and hysteresis can be a differential disease, though exactly they are not differential disease. But the brucellosis is far away from the differential diagnosis for the rabies. Presence of sulfur granules in the lesion characteristics of very common question actinomycosis. Actinomycosis. The chemical recommended to inactivate FMD is sodium carbonate, which is washing soda. I am really sorry. Washing soda. Washing soda. Blue tongue in sheep is transmitted by Culicoides. Culicoides. Okay, Anopheles is malaria organism, it transmits malaria organism. Culex, Japanese encephalitis. Aedes, known as many of the diseases like chikungunya, yellow fever, dengue, all these diseases are transmitted by Aedes. Penguin sitting is associated with, this is in case of bird, that is infectious bronchitis because of the swollen abdomen. Bottle-Jaw syndrome is in case of all of these cases because of a phenomenon known as protein losing enteropathy. Protein losing enteropathy. Enteropathy. You see, all of these organisms, okay, they are except fasciolosis, which reside Haemococcus parampestum reside in the digestive tract. So they are voracious blood suckers. So through blood they take out the protein. Fasciolosis in liver, so they damage liver, so protein production is low. So due to this protein losing, there will be accumulation of fluid on the submandibular region, that is known as Bottle-Jaw syndrome. The diagnosis of Newcastle disease is mostly done by hemagglutination inhibition test, HI test. Strain RB51, Rose Bengal 51 is used for vaccination against the following. You see, brucellosis. The test is Rose Bengal test. In case of FMD, can you tell which strains are usually given in India? Asia 1, trivalent vaccine. Next question, 156. Pinna pedal reflex, very common question. It is sarcoptic mange. Sarcoptic mange. Anemia icterus aggression. You see this particular term. Otherwise, you might choose wrong option. Anemia icterus aggression and swollen lymph node is seen. No, in none of the hemoprotection disease you will find aggression. Okay, so answer is none of these. Although you can say in case of trypanosomiasis due to violent convulsion, but it is not exactly aggression. Animal will not be aggressive. Next question. Chronic form of lamb dysentery is known as pine. Pine. Lamb dysentery is caused by Clostridium perfringens type B. Sorry, pine. Type B. Stroke is caused by type C. Type 1 A causes enterotoxemia. Type D, pulpy kidney disease. Feeding the silage that is improperly ensiled is commonly associated with listeriosis. Very common question. Listeriosis. Ascolis test is a thermoprecipitation test that is commonly used for diagnosis of anthrax. For brucellosis, Rose Bengal test. Corpus luteum of the estrous cycle is called corpus luteum spurium. Okay, corpus luteum verum is basically pregnancy cell. Corpus albicans is a scar tissue on the ovary. Corpus nigrum, I am slightly doubtful of this one. I think after corpus hemorrhagicum, the cell appears black in color, that is corpus nigrum. Slightly doubtful. If you know exact correct one, do comment down below. Biological test performed in immature rats for pregnancy diagnosis is Ascen-Jondak test. Okay, what happens actually in this particular test? The urine of pregnant mare, when injected to the mice, if it is the animal is pregnant, the mare is pregnant, then the immature rat will come to heat. Okay, Cubanese test is also a test to detect pregnancy in case of horse, but here the free estrogen is estimated in urine. Free estrogen. PSP, phenol sulfonaphthalene test, it is used for renal efficiency. Okay, renal function test, you can say renal function test. Pincher test is used for detecting free mating. Free mating. You know, when male and female both born under the influence of male hormone, female becomes sterile. It is Pincher's test. Maturation posture and winking of clitoris are common signs of uterus in case of horse male. 164. Brucella infection in cattle usually causes abortion at last trimester, 6 to 9 months pregnancy. Campylobacter causes in second trimester. Campylobacter causes abortion in second trimester, and Trichomonas fetus or trichomonad or whatever, trichomonad, it causes in first trimester. During pregnancy, endometrial cords are first formed in equine uterus at 40 days. In some articles or while searching the Google, found it is in the range of 35 to 38. Next question. Circumcised grayish white patches are basically a sign of fungal disease, that is mycotic abortion. Marshland abortion denotes an abortion due to nitrate poisoning. In cattle, ovulation occurs at 10 to 12 hours after the end of estrus. Okay. Next question. The hormone that is luteotropic during second half of canine pregnancy is prolactin. For first half, it is progesterone. Synthetic prostaglandin used for luteolysis in cattle is cloprostenol. Natural one is the dinoprost. Buserelin is a GnRS, gonadotropin releasing hormone analog. Phthalimide bromide is used for relaxation of cervix. Next question. Turning the fetus on the long axis to bring it to dorsosacral position is rotation. Answer is rotation. Repulsion means to pull the fetus. Push the fetus. Version, when the presentation is like transverse or vertical to make it longitudinal, is known as version. Extension or adjustment of extremities is self-explanatory. Diffuse type of placenta is in case of pig. In case of cattle, sheep and goat, you will find cotyledonary. In case of cattle, the cotyledons are of convex, while in case of sheep and goat, it is concave. Knuckling of petalum, of dropping of hog. This is a peroneal nerve paralysis. In case of, there is another option, obturator nerve paralysis, you will find frog sitting posture. The strength of lidocaine or lignocaine hydrochloride used for epidural anesthesia is 2%. It means 20 mg per ml. Weight by volume. Uterine inertia is considered as the frequent cause of dystocia. That means primary uterine inertia in the case of dog. Substance secreted by bovine conceptus which helps recognize pregnancies: interferon tau. Estrogen in case of pig. Ferguson's reflex at the time of parturition is related with release of oxytocin. Okay, this oxytocin will in turn increase the amplitude of the contraction or force of contraction, both force and amplitude, so that fetus can be expelled out. Surgical correction employed for chronic prolapse of vagina and wind suckling. This particular procedure is mostly done in case of horse, that is Kaslick's operation. What happens? Okay, this is vulval opening. So in this particular procedure, due to the chronic prolapse of vagina, so prevent that, you will take a skin here, mucocutaneous junction, you will take part of skin here, then you will suture this one. Okay, this particular portion, the vital portion, is left for the urination, so that there will not be problem. So when this particular will be closed like this, okay, it will look like this. So the chronic prolapse of vagina will be resolved, or the problem will be resolved. If the animal is pregnant, then during time of parturition, these sutures will be cut. Okay, so that it will widen up and the fetus can come out. That is Kaslick's operation. Shepherd's method and rolling method, they are basically used for correction of uterine torsion. Episiotomy, you know that when the vulvar opening is not adequate so that fetus can be expelled, then episiotomy or the dorsal, you will give incision in the dorsal commissure, to widen this one off, that is episiotomy. Testicular descent in bulls occurs at 3.5 to 4 months of gestation. The seminal vesicles and Cowper's gland are absent in case of a dog. Numerous papillae or spines in the terminal portion of penis. Common question, cat. Egg yolk is added to twice yolk citrate glycerol extender at the rate of 20%. Answer is 20%. Most simple and hygienic method of semen collection in boar is by gloved hand method. Condom method is used in case of horse. Appearance of giant and medusa cells in the semen is suggestion of testicular hypoplasia. In case of testicular degeneration, you will find in the previous year this question came, you will find the primary sperm defects. Large clots of or floculae plus in semen is in seminal vasculitis. Seminal vesiculitis, not vasculitis, vesiculitis. In frozen semen technology, the bull semen is cryopreserved at -196°C. Next question. Phase 2 or synthetic phase involves which of the following? This particular question is about the biotransformation of the drugs. When any drug or toxic comes to body, what body does. So in case of phase 1, it is oxidation and reduction, in which the hydrophobic substances, more hydrophobic substances will be converted to less hydrophobic substances. In case of conjugation, second stage is the conjugation, answer is conjugation. This less hydrophobic will be turning into hydrophilic so that it can be excreted out. Okay. Pharmacology questions. The second messenger which acts through release of inner solution calcium ions leading to cellular effect, IP3 phosphorylized by C, IP3. The H plus K plus ATPase, that is proton pump, is inhibited by the prazoles. Omeprazoles are proton pump inhibitors. Ondansetron, serotonin receptor, they act on serotonin receptor. Ranitidine, H1 receptor. Metoclopramide, dopamine or D2, dopamine receptor. Can you tell another pre-anesthetic which acts on dopamine receptor? That is why also they are also very good antiemetic like metoclopramide. I have taught you that it's phenothiazine. Nicotinamide is having which of the following? It is a respiratory stimulant, has analeptic action. Which of the following antiarrhythmic drug do not act by blocking calcium channel ions? Calcium ion channels. No, nifedipine is also calcium channel blocker. Answer is propranolol. Is beta blocker. Propranolol. This is beta blocker. Verapamil is also calcium channel blocker. The ergot alkaloid known for its ecbolic action. Ecbolic means it promotes uterine contraction so that the uterine contents can get out, or it helps in healing also. The answer is ergometrin. Oxytocin is also ecbolic. A long-acting beta-2 adrenergic receptor agonist which is used orally as bronchodilator in horse. This is a multiple answer actually. Tolbuterol and clenbuterol both act as bronchodilator in case of horses. A cysteine leukotriene receptor anti-allergic drug antagonist used in the treatment of all the leucast, Monteleucast, Jaffer-Leucast. Okay, answer is this one. Promethazine and diphenhydramine, they are histamine receptors. They act on histamine. I think histamine. I am slightly forgetting histamine. And Giluton, they block the lipooxygenase. Which synthesize this leukotriene. Dissociative anesthetic act by surgery question. NMDA, N-methyl D aspartate. NMDA. They are actually pharmacology question, but not exactly surgery. Phenothiazine tranquilization act on which of the following receptor? Just few time before I told you, it is dopamine, D2 receptor. Furosemide acts by inhibiting sodium potassium chloride co-transport. Next question. An example of second generation sulfonylurea is all of them. Answer is all of them. They are used to treat non-insulin dependent diabetes mellitus. Okay. Penicillin cause inhibition of cell wall synthesis in gram-positive bacteria by most probably binding with PVP1B. Okay, there are different class of protein, penicillin binding proteins. There is another which you should remember, PVP2A. It is associated with resistance. Antibiotic class possessing neuromuscular blocking action is aminoglycan. Some research papers also show that aminoglycan has some neuromuscular blocking property due to interference with the acetylcholine release. Next question, the last question. The GABA agonist action possessing anthelmintic following is piperazine. Answer is piperazine. Fenbendazole inhibits formation of microtubules, which is responsible for necessary for cell division. Parental, it is a neuromuscular blocking agent. Phenothiazine, I told you before this particular question was also there. It is dopamine D2 receptor antagonist. Okay, so this is all about the question paper of 2022-23. Now all the OPS paper in veterinary science has been solved. So I wish you all the very best, those who are appearing for the OPSC VS exam. So my best wishes. Okay, my blessings are always with you. Do well. So we'll meet in next class. So till then, bye bye. Take care.